Salut à tous. Alors aujourd'hui, nous avons l'occasion pour joindre le docteur Kartik, qui est le directeur de Vascular and Interventional Radiology MIOT International de India. Pourquoi aujourd'hui? Parce que c'est une affaire super importante. C'est qu'il y a beaucoup de Mauriciens qui atteignent de bonnes maladies et qui besoin de faire traiter, opérer, gagner des soins en Inde, Chennai, un peu partout. Et justement, MIOT International, qui se trouve du côté de Port-Louis, il est là pour faciliter sa démarche-là. Il est là pour rôder sa docteur-là. D'ailleurs, dans sa interview-là, je trouve beaucoup d'images, que ça peut avoir sa personne-là, et comment, bien sûr, ce traitement-là peut être fait. Sans plus tarder, we welcome Dr. Kartik, the Director of Vascular and Interventional Radiology, MIOT International, India. Welcome.
Thank you, Mr. Ryan. Thanks for having me on your show. Yes.
And first of all, tell me a little bit about yourself. Who is Dr. Kartik and why, and your association with MIOT International?
Definitely. So I'm Dr. Kartik Damodaran. I am currently working as the Director of the Department of Vascular and Interventional Radiology at MIOT Hospital, Chennai. I did my radiology training in the US and the UK, and I worked as a consultant in reputed hospitals in UK and Singapore for nearly 10 years before I moved back to India, to Chennai. That's my hometown. So I've been with MIOT for the last 4 years, working as the director of the Department of Interventional Radiology. My passion is to provide minimally invasive treatments for conditions which normally are treated by surgery, so the patients can have effective treatment without having to undergo a major surgery or a long recovery period.
And tell us a little about MIOT International. What is it? Is it an hospital or is it an association? Tell us a little bit more about it.
MIOT International is a 1,000-bedded quaternary care, meaning a super specialty hospital situated in Chennai, India. It started off as a 70-bedded single specialty hospital aimed at providing the best care for trauma and orthopedic patients. But over time, it's gradually grown and expanded into a 1,000-bedded hospital. Now we provide services in 63 different medical specialties, and we have 250 doctors working full-time in MIOT Hospital. So at MIOT Hospital is a quaternary care hospital because we provide really complex treatments for patients, and we have patients coming from different parts of the world for treatments which are not offered at other centers because we have the expertise. We're full-time there, and also state-of-the-art infrastructure to provide these treatments from diagnosis all the way to treatment and rehab, because treatment is not about just curing the problem. They need to get back to their normal life. That we focus on getting them back to where they were before. So that's where we are, and that's the reason we get patients from all over the world, almost 130 countries, visit us for treatments.
So you continue to follow up the patient after the treatment also, because what you just told me is that you bring them to the normal life, right?
Yes, exactly. Rightly mentioned, because it's not just about you have a pain in your tummy, we treated it. We need to follow it through to make sure it doesn't come back and give you advice to make sure that the chance of it coming back is less. So we follow them up via online consultation and various different methods. We do that.
And you mentioned you have patients from more than 130 countries around the world. Why do they trust MIOT?
Okay, MIOT is a very unique hospital in India in few ways. First, we have doctors, as I mentioned, 250 specialist expert doctors working full-time at MIOT. They don't work anywhere else. In other centers and hospitals in India, doctors, it's a common practice, they'll work at few different hospitals. So they'll go and operate in one hospital, the same day they may go to another hospital, so they're not available if the patient needs them. But at MIOT, the doctors are fully staying at MIOT all the time, so they can provide undivided attention to the patients, and patients are immediately taken care if there are any issues, because there may be a delay if the patient's gone to another hospital, but not in MIOT's case. First thing. Second, we have state-of-the-art infrastructure with laboratory facilities, diagnostic facilities, you name it, everything we have. Thirdly, we have great pride in having a multidisciplinary team approach. As in, if I get a patient, and patients don't come with one single problem. They may have diabetes, they may have heart problems.
Lots of complications.
Exactly. I'm not the specialist in heart problems. I'm a specialist in vascular problems. When they come to me, I do the treatment for my condition, but also involve the other team doctors to make sure we treat the patient as a whole. So, and then when we have to do a treatment, all the doctors involved in the treatment sit together, like what we do, and discuss the treatment and make sure we provide the individualized personalized treatment plan for that patient so he has the best outcome. Because if I just focus on mine, I may give some medicines which may have side effects on other systems, which I may not be, the best person to decide. So we have the team of doctors deciding together and make sure that we provide the best possible care for the patients. And those reasons, we manage to provide really good outcomes for our patients, and that's why patients trust us and they come from all over the world.
What are the diseases that you treat at Miote International? Cancer, heart problem, vascular problem? And
Yes, as I said, we have 63 different specialties, so we treat almost all the range of problems at Miote Hospital, from all the medical problems we can know of. So we do treat them. As an interventional radiologist, I provide treatments for many conditions from head to toe, which I can tell you about as well.
you are situated in Port Louis, and if you have a patient who come here in Port Louis, what do they bring? What they need to bring to your staff, and before taking a decision where to send them? Do they need to do the diagnostic here, or they need to bring all their results already with you here?
Okay, that's a great question. That's very important for the patients to know here. So what we have is we have the Miote Information Center right in the center of Port Louis, and we have a dedicated, excellent team of staff here. All they have to do, the patients have to, any problem, maybe a small problem or a major problem, or they may not know it's a major problem. They come and contact our staff here. They will take all the information, whatever they have, scans, test results, and then they'll decide which specialist with the best one to contact, and they will reach out to us in Chennai, and then we arrange a teleconsultation with the patient right here, and the patient can have a discussion with the doctor about the problem, and whatever information they have, based on that we can give a treatment panel plan for them and things. But in case they need more information or more tests, if it's available in Mauritius, they can have it done and pass the information. So when the patient comes for treatment, we know exactly what we're dealing with, because sometimes you know about one problem, you may not know about other problems. So we do make a package for the patient, and once the package is made and patient is happy to come, treatment cost is all planned, and we make arrangements from end to end, right from leaving Mauritius all the way to the hospital, the airport. We pick them up from the airport, do the treatment, necessary treatments are done, and then they're brought back to Mauritius, and we do follow them up at the information center, because we have teleconsultations to follow these patients up to make sure they are staying well.
So you mentioned the teleconsultation. So even if the patient is in India or Chennai or whatever, you're still in contact with them?
Yes, definitely. Yeah, because we do get patients from Sierra Leone, as far as East Africa and all places, and we do make contact. Nowadays technology is there, so we do the treatment and then we follow them at teleconsultation. Yeah.
And do you have some collaboration with some medical institution here in Mauritius also?
Yes, we work closely with the Ministry of Health, Mauritian government's Ministry of Health, and along with Swan Insurance, CCOM, MedScheme, and MUA, and as well as private patients do come in, and we've been treating Mauritian patients for the last 3 to 4 years with very good results, and patients have been very happy with the outcomes.
And you mentioned that you are the director of the interventional radiology department. What is interventional radiology and how does it benefit the patients?
All of us have heard about radiologists. Radiologists are doctors who do scans like x-rays, ultrasound. You have a problem, you have an x-ray done, the radiologist reads your scan and tells you what exactly problem you have, which part of the body, without opening your body. Interventional radiology goes one step further. We are even a super specialized branch of radiology where we use the same technology. We can see inside the body and deliver treatments to a tiny hole, make a tiny pinhole in your groin or in your wrist, and we can deliver treatments to exactly where the problem is by seeing inside your body without opening it up. So this way we can actually treat many problems in the body from head to toe without opening it up, where they used to be treated traditionally by open surgery. Now we can do these treatments just through a tiny hole. That's amazing, because you don't need to have general anesthesia, you don't need to stay in hospital for a long period, and the recovery is super fast compared to surgery. Because, for example, if you have a surgery for a condition, you will be in hospital for a week, still the stitches need to heal up, you have a long time to recover and get back to your normal life. We talked about being back to your normal lifestyle. Interventional radiology helps you get there in no time. So that's the advantage of it. And for example of things we treat from head to toe. We do treatments for thyroid goiters, we do pinhole treatments, we can shrink the goiters. For liver cancers, we offer treatments to shrink the tumor without having side effects in the body, called TACE and TARE. And fibroids, we treat a lot of patients with uterine fibroids. They have heavy periods, and you can treat them without having to remove the uterus. And we've had patients who have come from Mauritius and had these treatments at Miote. And we also treat for people with diabetic foot. They have blockages in the blood vessels. That's a very common problem in India and also in Mauritius. We treat patients, open up the blocked blood vessels, the wounds heal, and they don't need to lose their leg. So that's sort of the range of treatments we do is lots. It's just to briefly tell you a few.
And how about the cost? Is it the same like you're doing a surgery? You know, you open the body, or it's low? The technique that you are mentioning, is it lower than the normal cost?
Actually, costs comparably actually similar, because if you take about the whole hospital stay, your hospital stay with surgery is way longer.
Exactly.
My treatments, most of them 3 days, they're out of hospital. So if you take about intensive care stay, that's the most expensive part. Surgery is one part. Intensive care stay is like expensive because there are lots of monitoring, lots of medicines and all these things, and they have to be in prolonged recovery period. Not just stay in hospital, you have to think about the patient wellness. Patients want to get back to their normal life as soon as you can, because if you are a working professional, very active in your field, you want to have a procedure. Would you want to get back to your work in 1 week, or you want to stay in hospital for 3 months?
Yeah.
So that makes a huge difference. Productivity as well. You're off your work, again lost. So if you compare it that way, actually interventional radiology works a bit cheaper.
Great. Genicular artery embolisation, the topic of the hour. Can you tell us more about this?
So genicular artery embolisation is actually a treatment, a minimally invasive new treatment for patients suffering with severe knee pain due to osteoarthritis.
Knee pain?
Yes. Osteoarthritis is a condition as you get older, your joints get worn out, your cartilage between the bones get worn out, and they get severe pain and stiffness, and very severe stages they can't even walk from the bed to the toilet. So they have severe pain. So the currently available treatment options for the milder forms is to take medications, or the severe forms to have open surgery to remove the entire joint. Now, these treatment options are not the ideal ones we find, because patients coming to us with pain, they don't want to have surgery. They want to have a treatment which makes them better faster without surgery, because surgery involves cutting you open and replacing your joint. That's a major surgery. Lots of anesthesia needs to be given, and the recovery period is much longer. They want treatment in modern day where they can get something fixed, one stop, and they're back to the normal life very fast. And genicular artery embolisation offers exactly that. And at MIOT, we're constantly striving to provide treatment solutions for patients which will get them better faster without much side effects. So that's where genicular artery embolisation comes in, and that's what we're offering now at MIOT. Yes.
Can you share with us some few case studies where patients have benefited from genicular artery embolisation procedure, and also give us give them a tremendous recovery?
Yes, sure. We've had multiple success stories with patients suffering from knee pain due to osteoarthritis. I want to tell you about two patients. One is a very young lady, 40-year-old lady from Maldives. She came all the way from Maldives. She had severe knee pain due to osteoarthritis, and when she came, she was in the wheelchair. She can't walk. Even to walk to her toilet, she needs a husband to help her from the wheelchair to the toilet and back to the wheelchair again. So imagine a 40-year-old woman who's like in the prime of her life, wheelchair bound, and added to that, she had a special child who needs attention. So the husband was the main carer for her and the special child, and she was very depressed because she's feeling guilty that she can't take care of her child and not even take care of herself. And she came to MIOT seeking for a solution. And at a specialist at MIOT, we examined her, and knee surgery is the definitive treatment when you have a bad worn out joint. But if you're too young, you have this treatment. These joints don't last for more than 10-15 years. She's 40. If you do this now, people live longer. People live 80s, 90s, and they have multiple problems. So you do this now, they'll come to a stage that they'll need another replacement in the future, which is even more complex surgery compared to the original one. So we decided for her, she will have genicular artery embolisation, and that's what we offered her. After the treatment, within a few days, her pain score reduced from 10 on 10, which is maximum pain, to 2 out of 10. Within a week or a week after the procedure, she was walking, and she's able to take care of her child. Suddenly, she felt she's been released from the shackles of a wheelchair, and she can take care of her child, and she got her life back. That's one story I can tell you. And another person I can tell you is an old lady came from Tajikistan, and she had bilateral knee pain, very severe pain. Again, her son was very worried to see her in pain every day. She used to be a very active lady, even in her 80s. But now she has severe pain. She is not walking out of the house. Previously, she used to go to the house independently and do her stuff. But now she's housebound because of this pain, and he was finding her struggling a lot. So he brought her to MIOT. And initially, her knee surgery was planned for her. But when we evaluated her, we found out she had a severe heart problem, which will make her very high risk for surgery. So then we decided, yes, she needs to have pain relief, but she can't have surgery. So we offered her genicular artery embolization. Again, the same story. Within a week, her pain was off. She was walking, and the son was very happy, very grateful that her mother was without pain anymore. So yeah.
Doctor, can you explain more about this genicular artery embolization procedure?
Definitely. So this procedure is done in a cath lab, especially where this X-ray machine is there. And usually patients on the X-ray table, we give an injection of local anesthetic in the groin to numb the area. They're usually awake, they're comfortable, and then we put a tube into the blood vessel from the groin, and then using X-ray guidance, we direct this catheter or fine tube into the blood vessel supplying the knee joint. Then we inject a contrast dye, which is a special liquid which shows up on X-rays. We can identify the increased new blood vessels which are formed inside the knee joint due to this inflammation process. Once we identify these blood vessels, we use tiny medical grade plastic beads to block these newly formed blood vessels, which helps reduce the inflammation and pain in the knee joint. And because we block these particles permanently, those blood vessels are blocked, the pain reduces and the patients can stay pain-free for 3 to 4 years without pain. And after the procedure, we remove the catheter and everything, and within a few hours, they're able to walk. It's not like a major surgery, you're in bed rest, in ICU. You can go back to the ward, within a few hours you can walk. Within 2 to 3 days, we notice that the pain is subsequently significantly gone down, and they're back to the normal life. We discharge them the next day actually, so the patients can go.
And how many patients from Mauritius you already signed to Miyot International till now? Is it per week, for example? How many you got here?
As a whole, we roughly get 25 to 40 patients a month from Mauritius coming to Miyot, and we're hoping that doing this campaign will create more awareness about health issues, and then they can have benefit from much more patients can get benefit.
That's very interesting. But what advice would you give to patients to optimize their vascular health?
This is a very important question because vascular means blood vessels, and blood vessels are what takes nutrition and oxygen to all parts of your body, and you need to take care of them. It's very simple, but ways to take care of them. Lifestyle is first thing. You make sure you maintain a healthy diet, cut down red meat, cut down fats, make sure you take lots of green vegetables, and limit your alcohol, stop smoking, and these factors can affect your blood vessels. So healthy diet plays a very important role. Next thing is exercise. 15 to 20 minutes of exercise every day, aerobic, whatever exercise you do, need to do exercises. One, to keep your blood vessels circulation going, keep them healthy, reduce stress. And also the third thing is to regularly having health checkups to monitor your blood pressure, your sugar levels, and your cholesterol levels. As Asians, we have all this diabetes, blood pressure, and very common. It's very important to have, once you're hit 40s, to make sure you have all these health checkups to maintain these are under control. If they're not, you should take blood pressure tablets, tablets to control your diabetes, and cholesterol tablets to make sure your cholesterol is lower, because if you let them out of control, you don't know them, there's plaques build up inside your blood vessel, cause blockages, and that's when you run into all these problems. It may be the heart, or maybe the legs, maybe the brain, stroke, whatever it is. So taking care of yourself these ways can prevent you having these problems and have a healthy lifestyle into your old age. Yes.
And maybe the last question for this interview: how now we talk lots about Miyot International. How to reach Miyot International now? For example, in Mauritius, or we need to come here first. How to reach your team, Dr. Kartik?
Yeah, it's very easy. As I said, this center, Miyot Information Center in Port Louis, is open 6 days a week, and we have a very dedicated, friendly staff here. Any query, very small or big, you just contact them, reach out to them, and they will be able to help you with everything. You can have a consultation. If it just needs medical therapy here, they can offer it here, or if it needs you come down to Miyot Chennai, they will arrange everything for you to come down to facilitate all your travel, visa, costing, insurance, working with the insurance company. Everything can be arranged, and they can make your process very easy for you. So just don't hesitate to contact them if you think you'll need help.
And last question now, maybe all those who are watching us for this interview, maybe they are asking themselves, what's the minimum should I have to go to with Miyot International? What the minimum? Do you think someone with 100,000 rupees, 200,000 rupees, they can have a treatment with Miyot International?
Definitely possible, yes. It all depends on the patient's condition. They have, it's very hard to tell black or white, yes or no, but yes, we can at least make sure we can make them prepared with a cost package, because at least you tell them what exactly can be prepared for. and have the teleconsultation, and based on the reports they give us, we can come up with a package. At least they know exactly what their amount they're going to be dealing with.
And for a basic, for example, a basic treatment or basic checkup to Miyot, because if someone wants to go there to do a basic checkup, MRI, reading the MRI and so on, this with 100,000-200,000 rupees you can do?
Yes, it's definitely can be. Basic checkup is well below that one, so should be able. My Miyot contact team can give you all the information about that. From my procedure point of view, like say for genicular artery embolization, usually the package is around, they give in USD, probably like around 2,000 or 2,500 USD for the whole package, from coming to going, like the hospital stay, food, and investigations and treatment. Travel is different, but these things should be around this, just to give you an idea.
But the price is very good, $2,500 US for the checkup. That's very good, Dr. Kartik. Thank you so much. And nous disons à tous les viewers qui peuvent cette interview-là, même, pas oublier, even a checkup you do there in Miyot.
Yes. We have a full body master health checkup. Patients do come all the way from different parts of the world to have the checkup, and most of them are healthy and fine, because we do have a consultation with the doctor, just not just checkup. They get a consultation with the general medicine physician. They will give them advice on the lifestyle going forward. If they're healthy, how to make sure they stay healthy that way. If they have minor issues like blood pressure, or we pick up some issues, we give them advice and medicines to make sure they prevent this from getting into problems. So it's good to have a health checkup. As I said, that's one part of maintaining a healthy lifestyle until you're old. Yeah.
Dr. Kartik, thank you very much.
Thank you very much.
It was a pleasure to ask you some questions, and hope that you get it right, all the viewers, and do not hesitate to contact Miyot International here in Port Louis. We are next to SBM here in the Port Louis near DBM. You can come here and you have the whole staff waiting for you. Thank you so much.